I'm Logan Crawford, and right now on Spotlight, we are talking to a top plastic surgeon about a game changer of a technique. It is called the non-surgical facelift. And if you're like me, over 50, that has certainly got your attention. We're joined right now by Dr. Andrew Kornstein. Doctor, thank you so much for joining us here today on Spotlight.
It's my pleasure, Logan.
It's a great headline, the non-surgical facelift. It seems too good to be true, but it's not. You perform this service in your offices in Fairfield County, Connecticut, Westchester County, New York. In fact, you service the whole, basically, New York City metro region. Tell me how this procedure works and how it's truly non-surgical.
Well, I spent the first 20 years of my career doing conventional facelifts, so I know the anatomy well, and that's the foundation of everything. Then second, a friend of mine developed a very unique technology whereby we use radio frequency that has a certain temperature for a certain duration that we know turns on our genes to replenish our collagen, our elastin, and our hyaluronic acid. But the problem is the skin, and it's designed for the skin, but the skin of the face is just the wrapping on the package. So what I did was I used the technology, my knowledge of anatomy to really get the best of both worlds. So I go deeper, I go through the skin, I go into the facelift layer, and I'm able to tighten it, I'm able to lift, and to rejuvenate the quality of the facelift layer, which no surgery does. Surgeries only change contour. They do not change the quality of the tissues. And once you go, let's say about 45 or 50, the quality of our tissues are very important because they're not as youthful and as they are earlier in life. And therefore, if you do a facelift, a conventional facelift, it's going to fail in short order because the quality of the tissues are not good.
And also a traditional facelift, and I've seen people who've had them done, it's quite traumatic. I mean, there's a lot of bandaging, there's a long recovery time, there's a time when you seem to be overpulled and then you adjust, that kind of thing. This non-surgical facelift seems to offer quick results and non-invasive results, and a turnaround where you could be back in the office or in front of a Zoom camera in just a matter of days, right?
That's correct. So the average recovery is 3 to 5 days. And we do everything from hairline to collarbone. So a conventional facelift often leaves out the brow, often leaves out the quote unquote Botox muscles in between the brow. And the area that fails the quickest is the neck. And that's what people are really the most interested in, because when most people go in for a facelift, it's because the neck is dropped. And so because the neck is dropped, gravity is degenerating those tissues, again, weakening the tissues. So when they're lifted, then the quality is not there. And then that's why they don't have sustainability.
And with your procedure, are you doing anything invasive at all? Are you cutting the skin at all to get to the deeper layers, or is all performed from outside?
It's all performed from outside. So basically, it's done in the office. It's very easy to do in the office, because once the face is numbed, the patients don't feel anything. So most patients will opt for a little bit of laughing gas. Some people don't even want that. I've been injecting faces, like I said, for 20 years. So it's a pretty comfortable procedure. But once you're numb, that's it. These needles then go through the skin into the facelift layer, and they're able to do what a facelift doesn't do. And you mentioned the bandaging and the recovery. Well, there's also the anxiety that goes into a facelift before, that has to do with the medical clearance, thinking about being in a hospital or a surgery center, and then the idea of going to sleep. and being under an anesthesiologist care. So this takes away all that anxiety. But the other thing that I don't like about facelifts are we age in large part because we lose blood supply.
Mm.
And the idea of taking apart the face layer by layer surgically helps accelerate that loss of blood supply. We avoid that. The other thing is a facelift is generally a two-dimensional operation. You're lifting the layers and pulling them from the nasolabial fold and the jowl towards the ear. And you get a flat look and generally a shrink wrap or an accentuation of volume loss that occurs with age. With this procedure, there is no accelerated loss of vascular supply, and I can create shape, three-dimensional shape, by tightening some areas more than others. So you wind up with a much more youthful contour. And so I think it's a better operation. I think it's not just an alternative. I think it's a better way to go.
Fascinating. Now, when is a good time to get in to see you? I mean, there's people like me. I'm 60 years old. I watch my weight, I exercise, I eat right, but still you start feeling the neck get a little flabby. And it's just,
Right.
Something you can't prevent through eating right, exercise, going to the gym and all of that, or supplements. When do you get in? Should we wait until this is hanging on our collar? Should we get in sooner? Is sooner better than later? Let's address that.
Sooner is better than later, and for two major reasons. One is the longer you wait, the more the quality of the tissues degenerate, and they're not going to respond as well. Or put another way, more youthful tissues are going to respond much better than tissues that are more aged. The other thing is that by the time most people talk themselves into getting something done, it's past the point where I would want them to come in. Now, when people come in, if they do come in too early or don't need anything, at least in my office, they're going to be turned away, and we'll explain to them what they can do to temporize their face. In other words, to support the tissues while there's ongoing aging to slow it down, but they're not going to get a procedure they don't need. On the other hand, if they come in and they need the procedure and they're getting it just at the right time, they recover much quicker, they look much better, and they need less ancillary procedures.
And also it's a therapeutic procedure because you're actually increasing the blood supply, which you said is actually the underlying cause, that we're not getting enough blood to our tissues and so forth.
Exactly. So a lot of what we do surgically is it's like a Band-Aid. We're not really curing the problem, we're just covering it up. This is curative in the sense that we're tightening the tissues over the facial skeleton, and we age by bone loss. So our skeleton shrinks, and as our skeleton shrinks, the soft tissues become redundant. And under the influence of gravity, those redundant tissues sag. Now, again, that's why we do facelifts, to get rid of the redundant tissues, but we're just pulling them tight in a two-dimensional fashion. I think it's better to tighten them. In other words, or metaphorically, we're putting the soft tissues in the dryer. We're shrinking them, we're not pulling them. But we're also, as I said, rejuvenating the quality, which I think is very important. And that's why when I left in Manhattan, I was in Manhattan for 20 years, 20 plus years, and I opened up in Connecticut. My practice is called rejuvenative and anti-aging plastic surgery, because after years of practicing, I realized that I have to treat people who are over 45 differently than I do people who are younger. If you have young, healthy, good quality tissues, you're treated for contour only. If you're over 45, and again, things vary from person to person, but that's a pretty good guesstimate of when things start to change. You have to take into account not just loss of contour, but loss of quality of the tissues and blood supply to the tissues.
Can you get this procedure performed again? Can you get repeat procedures? How often would you recommend doing it, if it is recommended at all?
It's a great question. So it depends on the underlying support. So again, we talked about coming in earlier rather than later. If you have less underlying bone loss, you're gonna, and the tissues are tightened non-surgically, it's gonna last for a long time. If you come in later in life with advanced bone loss, then I generally will suggest a combination of this non-invasive facelift with the use of fat-derived stem cells, which rejuvenate the quality and the volume of your facial skeleton. In other words, it is your facial skeleton that gives the soft tissues its shape and support. If you've lost enough skeletal volume, you need to replenish that volume, because that's what the soft tissues rest on. That's what gives the soft tissues their shape. So if you wait long enough, then again, both are rejuvenative procedures. One is by heating the tissues to turn on your own genes for collagen, elastin, and hyaluronic acid, which is a sugar that hydrates your tissues. And the other one uses fat-derived stem cells to restore volume, but also restore circulation. And that's why after fat grafting, you actually age in reverse for about 3 to 5 years, because now there's blood supply and your body is able to send its healing factors to the facial bones, which it couldn't do before because it lost blood supply.
It's fascinating stuff. Some of the words you use, like hyaluronic acid and stem cells, we see those words thrown around a lot by spas and cosmetic centers, and even at-home creams say they have hyaluronic acid in it. Are these effective tools? Can people really help you de-age at the spa? Are these just Band-Aid approaches? Is it snake oil? Tell me what your thoughts are.
So the skin is the largest organ in the body, and its purpose, its raison d'etre, is to protect us and protect our inner organs, our functioning part of our body, from the environment. When we were cavemen, if there was a breach in our skin, it was high likelihood that we weren't going to survive. Now, I'm saying that because if we're treating the skin alone, we're just treating the armor on the body. We're not treating the underlying supportive structures. So we're really not getting a lot of bang for our buck, or getting something that's going to be long lasting. So that's why I'm not a big fan of laser, because laser rejuvenates the skin. A lot of topical creams rejuvenate the skin. Anything that addresses the skin alone, whether it's a laser, a chemical peel, or topical creams, again, I'm not saying they have no worth, but they don't treat the underlying cause. So you have to go under the skin to the supporting structures and really deal with the foundation. So the metaphor I use for my patients is, if you are treating the skin, it is sort of like painting the walls of a house where the structural elements of that wall are degenerating. And that's really a big problem, because if you have termites in your wall, you could paint it and it might look good for a shorter period of time, but it's not going to be long lasting.
Absolutely, absolutely. Is it better to get smaller procedures more often than an extreme makeover?
I think that's a great question. So I don't like extreme makeovers because it is you can't account for all the combinations of how things heal and how things go together. So I think there has to be an initial plan, and then you evaluate how the patient did from dealing with the primary causes of aging. And I think what happens is once a procedure is done, you can see the result and then reevaluate the patient and see what little nuances would improve them and in what direction. So if you do things that are very extreme, sometimes you'll burn bridges and the patients will not look like themselves, will not look like they want to look. If you do things to restore them to their natural selves and make them the best version of their natural self you can, then once they're healed, you can decide together, are we going to do this, or I would suggest that. And sometimes it's the patient who says, I want, now that I see my face, I think this bothers me. I want to try to address that. Sometimes I'll suggest something, but together we come to a plan. And that's something that it's a very interesting consultation where I take the before photos, put them side by side with their present photos, see where we started, see where we are, and then together we see where to go. And it really is a very effective way to go on the journey hand in hand.
And the best plastic surgery, of course, is the plastic surgery that you don't notice, that the person just looks rested, like they've been on vacation, that they just seem like they're in good health, but instead they've had their eyes done, they might have had their neck lifted, whatever it is, but it's not noticeable.
Right. Absolutely correct. So, that isn't, I agree with you, that's the best plastic surgery, but many practitioners don't have all the tools. So if they like to do one procedure or have a small little armamentarium of procedures that might not be what the patient needs, then the patient doesn't get the best result and they don't look natural. The other thing is some patients don't need a global procedure. You have to just evaluate them aesthetically, again, from hairline to collarbone, and say, this is an issue, that's an issue, this third thing's an issue. And you just treat 3 smaller but highly important aesthetic issues, and that's all they need. So I think the key is you have to have a good aesthetic sense. I think a lot of people, and I think, it's hard to say this, but I think it's really true. I think a lot of aesthetic practitioners don't know what beauty looks like, don't know what youthfulness looks like. Yes, they could point to it when they see it, but when you're trying to create it, they don't really understand what the components of those issues are. And if you don't know what youthfulness looks like, what beauty looks like, how are you going to create it? The second issue is you have to have the tools that the patient needs, not the tools that you bring to the table. So, experience and a wide breadth of training really helps so that you have hopefully what the patient needs in that particular case to deliver the right remedy for the right issue, aesthetic issue.
Absolutely. Well, you've got an artistic eye, you have innovative services, you've got a lot of experience. Dr. Andrew Kornstein, your website is kornstein.com. It's a great website. It's filled with volumes of information. You can find out about the non-surgical facelift and other procedures that the doctor performs. He services Fairfield County, Connecticut, as well as Westchester County, New York. And if you're in the metro New York City area, he is just a short trip away. Dr. Kornstein, thank you so much for joining us here today on Spotlight and sharing your insight and knowledge with us.
It was my pleasure. I love talking about this. It's something I've devoted my life to. So, I could do this anytime. It's
Look forward to
really,
talking to you
really,
again. There's a whole range of topics that people are fascinated by, a lot of questions they have. So you're our go-to plastic surgeon here on the Spotlight Network for now on.
thank you very much. It's a
Thank
pleasure
you,
meeting
doctor.
you, and I look forward to speaking to you again.
Same. And to our viewers at home, I'm Logan Crawford, thanking you for your time this time. Until next time on Spotlight.